Hi, I'm Dr. Nixon, and welcome to Healing Peak Regenerative Medicine's Longevity Channel. And this week, I want to talk to you about balancing hormones. In this society, we have normalized PMS, and we've also normalized menopausal symptoms like hot flashes. And the silent hormonal thing that is going on in men is young men are having more and more erectile dysfunction, but they don't talk about it with their doctors, and their doctors don't ask them because they think they're so young. And then older men obviously experiencing erectile dysfunction also. And so hormone imbalances are running rampant in our society, and no one is really noticing. Everyone is kind of normalizing them. And typical treatments for these are going on too much hormone replacement therapy. Hormone replacement therapy in certain instances is really good, but in a very more conservative way. And as well as injectable testosterone. Usually that's a pretty aggressive way to treat erectile dysfunction and other low testosterone issues. Or men get put on erectile dysfunction medications. Women get put on birth control to control PMS and acne. And actually all these symptoms of hormonal imbalances, or these uncomfortable hormonal symptoms that we've normalized, are just your body's way of telling you that your body is out of balance, inflamed, and needs some help. And so today I just kind of want to talk about what that means and some things that you can do to help yourself decrease inflammation in your body and normalize your PMS, normalize your hot flashes, and get rid of them most of the time. I would say 95% of the time without hormone replacement therapies, including birth control. So the very first thing you can do, and we talked about this last week in my YouTube video, so please refer back to that video for some more information regarding diet, but you can start going on an anti-inflammatory diet. That is the number one first thing you can do to start regulating your hormones right now. And the things that I have seen contribute to hormone imbalances the most in women is usually a dairy food sensitivity and a wheat sensitivity. And not everyone is sensitive to these things, but dairy and wheat tend to change hormones in women, and so avoiding those can be really helpful, as well as spikes in blood sugar. So if you're eating a lot of sugar or a lot of easily metabolized carbohydrates like white rice, processed foods, that type of thing, those are really gonna spike your blood sugars and drop your blood sugars, and that can create a lot of issues with hormones. So that is the first thing that you can start doing today to help balance your hormones. And the next thing that you can do is exercise. So weightlifting, especially in women, actually men too, is increasing large muscle mass. So glutes, hamstrings, and quads, all your major core muscle groups. If you start to really increase that muscle mass, you will see a much better regulation with hormones and an increase in testosterone for men and growth hormone. And it works the same for women, but ours are a little bit more complicated. But muscle mass is really a huge piece of regulating hormones. Doing too much cardiovascular activity, where if you're just going to be running, some people are made to run, marathon runners, etc. Like there is a small group of the population that is made to do these really long distance cardiovascular activities like cycling and running and those types of things. But most of the population would benefit from a varied exercise routine and definitely focusing more in increasing muscle mass to regulate hormones, deal with menopause, actually improve bone density, and decrease your risk of fractures long term. And then we're not really talking about that today, but those are other benefits of really increasing your muscle mass. And then the third thing you can do is make sure that your sleep habits are really good. So if you're not sleeping well, your cortisol is going to be elevated at nighttime when it should be lowest in the day, and your melatonin should be elevated. Your body makes melatonin. It's not just a supplement that you can buy. Your body should be making it on its own. And so if it's not, that's something that needs to be addressed. It's fairly benign to take melatonin, but usually it's just a Band-Aid. And so making sure you get good sleep. So what does that mean? And how do you know, right? Are you waking rested? Do you snore? Do you have sleep apnea? Are you using your sleep app machine? Those are all kind of things to look at. And then also making sure that your room is completely dark. You should barely, if at all, be able to see your hand in front of your face. And so if even the red light, there's been some research that shows even the red light in an alarm clock can affect female hormones. And so you just want to turn that clock around or put a washcloth or something over the clock in order to block it so that your room can get completely dark. And then the other thing you can do is make sure you wear yellow glasses to block the blue light out of the screen, because that will affect your sleep as well. So those are just a couple things. I'm actually going to do an episode on sleep hygiene and how to make sure that you get better sleep. But those are just a couple little things you can try today, and making sure you get good sleep will really help hot flashes, PMS, and testosterone and erectile dysfunction, all the things that I specified at the beginning of the video. The last thing that you can do is meditation or prayer, anything that you can do to decrease your stress levels, decrease anxiety, decrease your cortisol levels, which is that stress hormone produced by the adrenal glands. Those spikes in stress hormone, you may notice if you've had an extra stressful week, your PMS is going to be worse. Or if you're a migraine person, if that's your vulnerable spot, you're going to have more migraines when you're stressed, right? Or if you're perimenopausal, postmenopausal woman that is dealing with hot flashes, you're also going to notice that stressful days you have more hot flashes, you may have more night sweats, and so really doing things to decrease your cortisol levels throughout the day, which is kind of where the blood sugar piece comes in that we talked about earlier, is really important. And so I really love this app called Headspace. I think if you join for the year, it's like $8 a month. They have a ton of different types of meditation in there. Short ones, long ones, sitting ones, walking ones. It's really been very, very handy, and you can really make it what you want it to be. And I personally struggled with being able to meditate regularly because I didn't have something that made it easy for me to choose. And so Headspace, that app, has made it super easy. YouTube also has a ton of different meditation videos that you can follow, or even just 2-minute breathing exercises that you can do to lower your cortisol levels when you're stressed out. And you'll find that if you do the things that I've just said, that your night sweats, hot flashes, PMS, all of these things over a period of time, hormones take a while to balance, especially erectile dysfunction, all of those things, they usually take 3 to 6 months, and that's being a little bit conservative. Sometimes if hormones have been off for a long time, it can take even a year or more to get them fully balanced, but you should start to see that within 30 days to 2 months of really, being careful with the things that I've mentioned, that you will see improvements in your hormones. And that's all for today. Thank you so much for joining us. And those of you who have subscribed, thank you so much. If you haven't yet, please like our video and subscribe to our channel. And if you're interested in more content related to prolotherapy, platelet-rich plasma injections, longevity, and healing solutions to live the best quality of life you can and to live limitless and by your rules, that is what this channel is about. So we would really love to have you, and thank you for joining us.